All right. Good morning, everybody. Welcome to our December Southside Wellness Coalition all-member meeting. It's great to see you all virtually and see so many people in person as well. Excuse me. Before we get started with our agendas today, I'd just like everybody to go around and do a brief introduction. So I can kick us off and then I'll pass it to the folks in the room. My name is Liam Hudson. I have the honor and privilege of currently serving as the chair of the Southside Wellness Coalition, and I'm the co-founder and CEO of the Lean In Project, based in South Boston, Virginia. So I will popcorn it to Veronica.
Specialist here with Southside Behavioral Health, and I will pop it off to our new team member, Jenna.
Hi, everyone. I'm Jenna. I'm on my 4th day here. I'm excited to be here and excited to see what everything's about.
All righty, gonna popcorn it to me, Jenna?
Yes.
All right, hi, everybody, I'm Catherine Maloney. Been here for about 6 years, on and off the leadership team, and glad to be here in my holiday attire.
She does, she looks fabulous.
Damians, new. I appreciate the opportunity to possibly serve on the leadership team. I hope all of y'all have a Merry Christmas. And I hope, since we probably won't be seeing anybody again, that y'all's 2025 is better than 2024 and all previous years.
Thank you.
Yes.
Hi, my name is Stephen Wilson. Been with the Wellness Coalition over 6 years now, I think. I am a member of the local recovery community, and we'll wish everybody happy holidays, and may you enjoy the best of the season.
All right, back online, Liam.
All right, let's see. The first person I see is Chris.
Good morning, everyone. I'm Chris Pennington. I am a member of the Southside Wellness Coalition leadership team. I am also the chair of TARP, our local trauma-informed care network, and I'm co-founder of Resilient Pathways in Chase City. Hoping everyone has a great holiday season. And all I can see is Liam. Let me see who else is on here. How about Elizabeth?
So I always like to say I have two most wonderful times of the year. I changed my background because last Friday I worked for Girl Scouts Virginia Scout and our cookie season started. But I'm the behind the curtain person. So part of my behind the curtain work is getting new troops started. So I'll actually be in South Boston this evening. We have a new troop starting. And so one of those things is getting them started in the cookie program. So there's a lot of things this time of year in addition to the holiday season, but I wish everybody a happy holidays, and it's been great in 2024 connecting with this coalition. It's been a pleasure.
Thank you for being here. Next up, let's see, Brian.
Good morning, everyone. Brian Price with the Virginia Rural Health Association.
Morning.
And I'll popcorn it to Sandy Curry.
Thank you, Brian. Good morning, all. I hope everyone has a very good Christmas. I'm Sandy with BDH, and I just found out that calories don't count during the season, and I'm hoping they can extend it through the Girl Scout cookie time as well. Those Thin Mints don't have any calories, right? And
Yes, they make you thin. You know that's why the girls only sell them for a short period of time of the year. Seriously.
Very good.
Yeah.
And Jeanette, I'll pass it off to you.
Good morning, everyone. I am Jeanette Grimes. Happy to be part of the leadership here. I'm also a community health worker in Brunswick County, and glad to be traveling down to Danville for our staff gathering. So it's so great to be virtual and to be able to multitask. So I hope everyone enjoys whatever they celebrate, whether it's Christmas, Hanukkah, Kwanzaa. So just enjoy. And I too will take part in Girl Scout cookies gladly. All right, let's see. Who can I see? How about did Veronica go?
Yes.
Okay. How about Breanna?
Good morning, Breanna Link, Population Health Manager with the Virginia Department of Health. So I cover Pittsylvania-Danville and Southside. And I will popcorn it to Amy.
Good morning. I'm from Virginia Legal Aid Society and just here to learn and see if there are any opportunities for us to assist the population that you all work with.
Thank you, Amy.
And I will send it over to Shelley Clary.
Good morning, everybody. My name is Shelley Clary, and I am the Education Specialist at the Virginia Poison Center at VCU Health, and I hope everybody has a happy holiday.
Thank you. All right, Allison.
Hey, good morning, everybody. My name's Allison Byrne. I am the Community Engagement and Partnerships Coordinator at the Central Virginia VA Medical Center. Hope everybody's having a great holiday. Also looking forward to Girl Scout cookie season. And I will popcorn it to Elena. Have you gone yet?
No, I was running late. So I'm Elena Martin. I am on the leadership for the coalition, and I'm also the housing case manager at Tri-County, which is why I'm running a little late today. And I'm actually in the car right now, so I can't see who to popcorn it to. Can you help, Liam?
Sure thing. I think, Kenan, it's you. Oh, wait, I can't hear you, Kenan.
Oh, you can't?
No, now I can. Can y'all hear? Can you hear, Chris? No? Okay.
I wonder why. You're not on mute.
Go right there, tell the owl to be.
Yeah, I know. Good morning, Al.
Good morning. Now we can hear you.
Fiscal agent for the Southside Wellness Coalition. Good morning, everybody. Technology always continues to be a struggle.
Yes, it does. All right. Well, thank you, everybody. Welcome, welcome. Excited about the holidays and cookie season. Glad they're overlapping a little bit this year. Before we pull up this week's agenda, I just want a moment for everybody to review last month's agenda. You should have received it via email. If you did not, please let us know and we can make sure that you're added to the list.
I don't have a copy in person.
So I'll just scroll really slowly, give folks a moment to review and read anything, and then we'll call for approval. All right, at this time, do we have any calls for edits or questions? Hearing none, may I please get a motion for approval?
To approve the minutes from November's meeting.
Elena,
I second it. Yep.
Okay. So we got a motion and a second. Approved. Thank y'all. And then Kenan, I'll ask you to share the December meeting minutes or agenda if you don't mind.
Absolutely.
All right. Y'all can see Zoom did some cool updates.
Make that full screen for me. Are you able to zoom in on that a little bit, Kenan?
Great question. Probably not.
Okay.
Roll it down. Maybe down at the bottom.
Yeah, down there at the right, there's a little sliding bar, the bottom right hand of the screen.
All right.
There we go. Oh, that's perfect. For me, is that good for the rest of y'all online? Okay, cool. No, you can, or I just want to introduce Breanna and then, yeah. All right. Well, this morning we have a wonderful speaker for you. Many of you know her. She's been with us for a while. Miss Breanna Link, we appreciate you being here today. And I will turn it over to you.
Awesome. Thank you, Liam. As I mentioned, my name is Breanna Link. I'm the Population Health Manager. As I said, I cover Pittsylvania-Danville and Southside, so just a little service area there. I wish I could be with all of you in person, but like Jeanette mentioned, we are having our staff meeting and holiday gathering today in Danville, so I quite couldn't teleport back and forth quick enough. Population health is the newish division within our health department, so a lot of people still don't really know what exactly we do or what that means. I have the best team. All of our community health workers fall under the population health division, and I have some of the most passionate, dedicated staff you will probably ever meet who always just want to do what's best for the community and help. We do a lot of the outreach, any community events. We've helped put together a lot of expos on different subjects. We work a lot with Brunswick Health Ambassadors. Jeanette and Sandy are both on my team. My first internship in public health was working on community health assessments, and I had the opportunity to help with a focus group and just kind of really reinforced why I love what I do. And I really got to hear what other people say and what people really think we need in the community, which is an awesome opportunity. And then my first paid job in public health was actually as the coalition coordinator for RACEAP as the Pittsylvania-Danville CSB. So coalitions also hold a very special place in my heart. So give me 1 second, let me share my screen with you all. All right, can you all see that all right? Okay,
Yes.
See some head nods. So today I'm going to be talking about our community health assessments, which can also be called community health needs assessments. The health departments do the health assessments, whereas hospitals call them community needs assessments. So the community health needs assessment is what's done by the hospital, and it's required by all nonprofit hospitals by IRS code under the Affordable Care Act. So they have to do it every 3 years, whereas health departments usually do it every 5. However, a lot of times we will do it every 3 years because it makes it a lot easier. It makes a lot more sense for us to do it in partnership, and we can get a lot more people involved. The outcomes of the community health assessment really help us determine where we should focus our efforts, what's important to the community, and really helps us determine what we should be doing to best help the community. So we want everyone to feel like their voices are heard. It also helps us with funding because we are able to use some of that information that we collect for grant applications and other things. And again, helps us determine what grants we should apply for. This is just kind of a brief overview of the process. Typically, we start at the local health departments and the hospitals will get together. We start planning, determining who's going to take lead on what, really determine our strategy and who all needs to be involved. From that point, we will start talking to some of the stakeholders or groups that we think could really help us, and also that we think the data could help them as well. Once everyone's on board, we go through the process of looking at our surveys, trying to make sure they have all the data the hospital needs, as well as all the data that we want to collect, while also trying to find that fine balance of having a survey that's not too long, because we know someone sees the survey, especially when it's printed out, and it's 4 or 5 pages, they're not going to want to take the time to complete that because it is so long. So we try and keep it a decent length, and then we will distribute it. Typically, we have paper surveys available because sometimes it's easier, especially if you're at an event. And then it's also, we know a lot of places, especially in Southside, don't have great internet access, or if people want to have them at their organization to hand out when people are checking in or something like that, they have that opportunity. We also have it available online. We have flyers, the little QR codes, and I can drop the link in the chat as well if anyone's interested in completing it. I think Kenan has some paper copies available in the meeting room that we will get from her later. So please take time to complete that. It's really important. We do look at all of them. And once we get the data back, we will analyze it, see what the most common needs were identified as, some other areas, and how we can use that data. We will then do data presentations to show the community and stakeholders the data that we collected. And then from there, we work on IDing the priority areas. We'll ask people, what they think the most important areas are from what was voted on, or use the most voted on areas to really identify it. From there, we go into the CHIP process, which is the Community Health Improvement Plan. Working on that is really a community-led effort. We really want the community to take charge and have the opportunity to tell us what they think we can do to address those needs that were identified. This is just an example of some of the stakeholders that I've been involved in the past. We worked a lot with some colleges and universities. University of Lynchburg was really helpful and helped with some of the question development that we used in Pittsylvania-Danville. And so I use a lot of those same questions for Southside, because I do want to have the same questions and everything involved, just because we want to be able to compare, since we do serve both districts. We also use a lot of healthcare, so a lot of the federally qualified health centers, we've had them with paths. We try and look for free clinic, any medical offices that are interested. Big brothers, big sisters, we can try and get information from staff as well as parents. Food banks, Boys and Girls Club parents, Department of Social Services has helped by handing them out for us. We also work with other health districts. For example, when we did Pittsylvania-Danville, we also worked with Lynchburg and the Piedmont Health District, which covers Farmville, because with that one, we are working with Centra, and they have a very large service area that works with all 3 of our districts. Health-related organizations, for example, health collaboratives, coalitions, anything like that. City and county administrators, town councils, area agency on aging, our CSBs, thanks Kenan. Our school systems, we try and get through parents and the teachers, any other nonprofits that may or may not be health related. Legal aid we've worked with before, as well as local YMCAs. Skipping ahead. So where we are with our Southside Community Health Assessment, VCU recently did their own survey several months ago, so they have shared all that data with me so we can incorporate that. We're also working with Centara right now. They've been really helpful for us. They helped us get it translated into Spanish, so I do have English and Spanish versions available on paper and online if anyone needs that. They're also helping us with some of the data analysis, and we have the surveys live right now. They will probably go through early to or mid to end of January at this point, just because I will not be here beginning of January to cut it off. So I'll probably just let them through the end of January. We are working on scheduling some focus groups. I know Kenan's going to help me with a few in mid-January, so we're really excited about that. The focus groups are 10 to 12 people at max, just because we want everyone to have a chance to share their opinion, as well as really have a good conversation without it being too many people. We will do one with Kenan at Southside Behavioral Health during the day in Mecklenburg, and we were also going to do one in the evening in Halifax. If anyone has suggestions for locations, I would be very grateful. Right now, I might try and talk to the Y about using their community room, just so we have a couple of different times and places for people to participate. We'll also be doing one with some of the Brunswick Health Ambassadors and doing one with the Tri-County Community Action and looking with their pregnant and new moms. That way we can have a big variety of people and hear a lot of different points of view. Once that is done, as I mentioned, we will be doing some data analysis. Then after that, when we get the data back, we'll compile it into a report where we can then do the data presentation to organizations, which I'm happy to do at a future meeting of Kenan if you're interested. And then we will work on the community health improvement plan. That's just a brief kind of overview. Our community health assessment is a huge undertaking. With Centra, it's pretty much a year in planning and implementation. Just trying to get everyone involved and get as many opinions heard as we can, because we really do want to hear from everyone. Shout out to my team, Jeanette, Sandy, everyone who's not on here. They are amazing, and we are really excited that they can help us implement this. My other big ask is, if you talk to anyone that has any pull in funding, please, please, please advocate for our community health workers. A lot of my team, most of my team is under COVID funding, and that will be going away in the middle of the year. So without any more funding, I will lose my team. And they're a huge asset. We have community health workers in tri-counties. We have community health workers in PATHs. We have community health workers through VDH. Brunswick Health Ambassadors, and they really do help make a difference. And I could not do the work of 5 localities on my own. So please advocate for them. They're a huge asset. And thank you for listening to me. Does anyone have any questions? Microsoft building. Thanks, Liam. Do you have a contact for that you could send me?
I do. I can email it to you later.
Awesome. Thank you. And I will put that link for the online survey in the chat if anyone is interested in completing that. Otherwise, that's all I've got, unless anyone has any questions.
Breanna, Walbridge might be another one. They operate about 500 to 600 people over at Microsoft also.
Okay.
So Kenan or I can get you that contact.
Okay. Walbridge Construction, absolutely.
Thank you.
Breanna, did you have the date on when you wanted to have that focus group in January?
I think we said, give me 1 second, I can find it. I think it's January 15th and 16th.
Okay.
Is what we had said.
Okay. All right, I'll get a flyer working on that.
Awesome. So I can do one too if you need me to.
All right. Thank you, Breanna. And just to reiterate, I know we all heard the importance of community health assessments, but speaking as somebody who pulls a lot of data to talk to legislators and decision makers, we use these kinds of tools and resources all the time. And if folks in our community don't fill them out, then it doesn't look like we have a need. So just, really want to stress how important it is, both for knowing the needs in our community and for getting some of those resources Breanna mentioned, because community health workers are absolutely vital to making sure we have accessibility and health resources in our region. They're really, really important in rural regions. So just wanted to just stress, please fill out your community health assessments and tell everyone in your family and all your friends and everybody who could possibly ever need any health related resources, please ask them to fill it out.
And it's also on our Facebook page. I kind of keep trying to reshare it. So if the Pittsylvania-Danville and Southside Health District's Facebook page is on there, if you want to share it. I can put my email in the chat as well. If anyone wants to email me, if you want more copies of the flyers or if you want hard copies of the surveys, and I'm happy to get those to you as well.
Thanks, Brenna.
All right, I'll add that to the minutes, and for the 5 people that are here today, we have additional hard copies as well as the flyer that can be posted around in community locations. And the Ellen from Box Glove is sharing that information on our coalition social media. And Sarah, our marketing coordinator at Southside Behavioral Health, is also sharing the information on our agency social media.
Thank you, Kenan. Okay, so I apologize, I don't have the agenda in front of me, but I think next I saw the election updates and bylaw updates. Is that correct, Kenan?
Yeah, we've got updates from the leadership team and then moving into the elections.
Okay. So our update from the leadership team, we met last week for our final meeting of the year. Prior to our meeting, we intended to engage 2 different youth groups, one in Mecklenburg and one in Halifax. We successfully met with the Mecklenburg folks. We rescheduled Halifax until January 15th, but I thought this was a really successful program. It was a Jenga activity that we learned about from the coalition in Charlottesville, and all of the Jenga pieces had mental health related questions on them, and I thought the youth had a really great time engaging. They were very engaged. They gave us a lot of, I think, great insight into where they are and how they think about mental health, and also the fact that no one really talks to them about mental health or mental well-being. So I think, definitely gave us a lot of good pointers for how to engage with youth moving forward. As you'll see in just a minute, we have also been in the process of updating the bylaws. I'll pull those up on screen in just a second. But really, I think our intent with updating them was less about updating the function of the bylaws and more updating the approachability. And so we really tried to center using less legal jargon and more plain language. So that our bylaws could be more approachable. And then I won't get into it too much because that's our next agenda item, but we also discussed the upcoming election and a bunch of upcoming events, which we'll also talk to you guys about in just a few minutes. So I will go ahead and put our bylaws up.
Hang on, let me stop the share.
It's okay, I cut you off, Kenan.
Good.
And then I can. Okay, so as I said, our intention wasn't to change the focus or the function of the bylaws at all. We really just wanted to make them more approachable. There was a suggestion to add the physical meeting space in there, so we did that.
Dennis, one question. Says, who knows of you? Do you have any?
I hear someone talking, but I couldn't hear the question.
Oh,
Okay, I'll use the other voice. Leah, do you have any youth members?
Currently, we don't, but it's something we are actively working on.
Okay, copy.
I think the ultimate goal, Dennis, would be to have a youth coalition, but for right now, definitely getting some more youth representation on our coalition.
they aged out or dropped off. Yeah, but as of right now, today, no.
Kenan was just saying that in the past we have them, but they age out very quickly and then become adult coalition members. So it's, and I think what you did in Mecklenburg County and our rescheduling for January for Halifax is a good go-to, right? That's the purpose of those meetings.
Yes. Well, yes, that and to, I think, reframe how we are approaching the youth in our region, because I think something we heard is that our messaging doesn't land with them because I think what I took from it is that it's too technical and is based in principles that I think we all know very well, like trauma-informed care or harm reduction. And what I heard at Mecklenburg is that the youth don't really know what those phrases mean and definitely don't know how to apply them in a practical sense. So I think even updating some of the ways that we engage with folks in the community would be helpful in getting more youth involved.
Hey, Liam.
Mm-hmm.
Have we tried working with the schools or any youth serving organizations? Like, I don't know if we have them out there, but if there's a Boys and Girls Club or anything out there that we could try working with.
I think the closest Boys and Girls Club is Danville.
Okay, didn't know if there's one out there. Sorry.
Yeah, no, you're good. We have been working with or I've been chatting with an individual called named Taquan Logan. He has an organization called Life, and he's currently trying to get a Boys and Girls Club chapter in South Boston. So definitely want to stay linked with him. And if any of y'all do youth work, he's doing a lot of great work, so I can connect you with him as well.
Yeah, and that's one thing we've done with the coalition here is we kind of at back to school nights with the middle schools and the high school. We kind of put tables there and try to recruit from back to school night.
Oh.
Or anything when the school, like when parents are there too, when they go looking at schedules or anything that way, especially because a lot of them need the volunteer hours and we're able to count it as volunteer hours here. So that might be something to look into.
Okay. Good to know. Thank you, Brenna. Another thing we heard regarding youth is that, and I'd be interested, Brenda, if you have any experience with this, but particularly because we do have such a heavy focus on mental health and substance use and suicide, something a lot of the folks said is that adults may be nervous to send their kids to a group like this for fear that maybe something about the family would come out, or maybe, I think just nervous about what their kids are gonna be talking about related to these topics. And so if y'all have any conversation points that you have with adults or parents before, they kind of give consent for kids to participate, or any sort of resources you share, I'd be interested in looking at those too.
From in the room, we wondered whether you could reach out to Mr. Logan about being possibly our January or February guest speaker to talk about it.
I do know he works during the day, but let me see. I can always ask.
Okay, if you could do it online.
Yeah, he just works he works at the Michelin factory in Danville. So I don't know what his full-time job is at there. So, but I can absolutely ask, and at minimum I can put an email chain together.
Okay, cool, very cool.
Um,
Can you hear me?
I can hear you a little bit. I don't know why I'm like yelling back at you. Can you hear me?
I can hear you.
I know. Okay.
Maybe this is the problem.
All right, I've been running my mouth and haven't been giving y'all enough time to read over the bylaws. So feel free to tell me to quiet up or ask any questions if you have them. I'm just kind of slowly scrolling.
Change to donate to the day in 2024.
They're all just wording changes.
Yeah.
They're all wording.
They're all basically just more concise.
Cosmetically free.
Yeah, plain language. So they are available in the Survey Monkey, right, Kenan? They're linked. Okay, there's a link to the original bylaws and the red line bylaws. So when you all go in to vote for the leadership team members, you can also vote and approve the updated bylaws.
Yes, it's the fourth question, and the newsletter contained links to our landing page where you can access the original bylaws from 2020 and the revised version. And in the Survey Monkey link is question number 4. So when we vote, the updated bylaws will include a line that says that we have the majority of members passed as of the 19th, but the election is open until the 27th. So all the active members will get a reminder from Ellen, and it'll close on next Friday at midnight.
At midnight, okay, not at 5 p.m. Okay,
No, midnight.
okay.
So a question on the amendment of the bylaws, are we gonna add a section that, because these last ones were done in 2020, and then I thought we needed that to be another article or another amendment of the bylaws? Or do we not need that?
What do you mean?
If you see Article 10, is the amendment of the bylaws, it says the last time they were updated is December of 2020. That's when it was voted upon and accepted.
Right, so we'll have to update that.
Okay.
And say that the majority of the members present Southside Wellness Coalition, the virtual meeting, and then closed on the 27th of December 2024.
Okay.
And that's how I'll reword that at the very end.
Okay.
Right.
Will this stay as a timeline, or will you replace?
I'm gonna probably put it on the website, and it won't replace it. It'll show it as the progression.
Okay, all right.
Are we okay with that? Does that make sense to the leadership team?
That makes sense to me.
Yep, sounds good.
Yes.
Okay, any other questions on our bylaws or any?
I know. Hey, Liam,
Yes.
I have one other question. On your voting, does anybody care that you don't need a quorum or something present at a meeting when you do the votes?
What now?
On the voting?
What about the voting? Hang on.
There's no mention of a quorum, is what you're saying.
Correct.
Well, we do a
Numbers.
simple majority. That's what's in there.
Correct.
We only have currently online, in terms of our online membership, it's documented by Foxglove. We have 54 active members. We have over 2,000 subscribers to our newsletter with over a 30% open rate. But so what we'll do is the Survey Monkey will need to show 25, or no, it's 27. Plus 1 responses by December 27th, next week. Otherwise, I'll notify Liam that not enough of our members have responded. But we will do an individual outreach over the next 3 days with my team to remind people to vote.
So there is, in a sense, a quorum.
Yes, they're always in, yes,
Okay,
yes,
it just wasn't written in here.
yes,
I
yes.
thought the new quorum was the number of people at the meeting.
That's what it
Right,
says.
but we haven't been doing that since COVID because we went hybrid. Because that would mean that the number of people in the room right now. Right, I don't know, I mean, we could change it, but we changed it back
The
during
new
COVID.
bylaws say the number of people at this meeting, half of 50% of that plus 1. We don't need the dead membership that never shows up to vote.
Okay, well,
I mean, that's why I asked the question.
all right, well, Liam, that's on the
Well,
floor.
then we have to define what active membership means.
Active.
You did. It says active members are those who have signed the coalition involvement agreement.
Right, which I have 54 people who have done so.
Mm-hmm.
Right, but the bylaws as written in the revisions don't say that. They say the people at the meetings. Or something similar to that.
Wait a minute, membership.
Well, this says to conduct business. It doesn't necessarily say,
This is business.
well, you're
It
right.
is business.
You're
I
right,
agree.
okay, hold on, let me go around.
Add an outline of membership responsibilities, expected
Majority of members
contributions.
of the signed coalition, okay. Well, it does say in emergencies, and so we put this in place during COVID. And I guess that's not something that the team looked at to revise this go around.
And
I feel like if we announce ahead of time that we're going to be doing elections or revising bylaws or anything else that requires a vote,
Okay.
people need to show up for that meeting if they care to vote. We shouldn't have to chase people down to ask their opinion.
I kind of see both sides of this, and I'm gonna be the monkey in the middle here.
I'm not
But
worried
I
about
mean,
either side.
I don't, yeah, I'm not either, it's gotta be defined.
Okay, all
Yeah,
right.
to me, that's the bottom line,
Right.
define it. And if we wanna do this and you're okay with hunting people down to get that 26 person instead of how many of us are here, but I think having those members in the community have a voice is a good thing.
Well, I think that goes back to then the revision of the bylaws, the way they stand though, because if maybe the voting explanation, because that didn't get modified since COVID, is maybe we need to revisit that section and then do another vote in January. Can I make that suggestion as leadership team member?
I'm sorry,
Leanne?
I was reading a message. What did you say, Kenan?
I was suggesting, since we are revising the entire document, but yet we didn't revise the voting, to take out the reference to the electronic voting. I mean, that's basically what you're saying, because if they don't show to the meeting, if they're not on the
No,
meeting right now, they don't vote.
Well, no, I'm saying I'm either way is fine, but if that's the intent here, maybe it needs to be spelled out a little bit differently.
Okay.
Because, there's a point for saying, if you don't regularly attend meetings, why are we listening to your voice,
Correct.
right? Why are we hunting people down who may not have come to a meeting this year? I get
Okay.
that, but also, right now, as it says, that's how we define membership, that you sign that agreement. And I don't think somebody who signed that agreement should not get to vote either. That,
Yeah, right, right.
but then you got the opposite problem of hunting down people at what point do you become inactive? Do we cover that in here? After 1 year of not showing up, do we track that? You see where I'm coming from?
Do we care?
And do we care? Correct.
When we have a national election, you have a choice whether you want to go show us the polls or not. If you don't show up, they don't come to your house and ask you.
Correct.
You know,
Well, do we want to have a bylaws committee meeting to talk about this between now and next meeting and table this, or?
I would table the bylaws.
Okay, you want to table it? All right, well, so Stephen has made a motion. Can I get a second?
I'll second it. Elena.
Elena, okay, hang on.
So we're gonna table that for now? And look at the voting table to
Hang on,
review
I'm gonna
voting.
write that down, hang on. Oh, hold up a second.
Review voting and membership, correct? What we call membership. And I'll just caution us.
Or active membership.
Active membership, yes.
Well, I think you changed your verbiage on when we vote, how we count a vote. Is the people sitting here and the people on Zoom, that is our quorum, not debating who's active and who isn't.
Right.
It's just how many people are here for
But
this vote. If you want a wider range, put the vote out there online and let them vote as they get to it, if they can't make it to this meeting. But if you want to vote, like right now on something, then you vote with what you got present.
But I would argue that if you have 54 people, unless 26 of us are in this room and on, there can be no vote, because that's not a quorum.
I've never seen 54 people in this.
I agree. I'm just.
Now I get it, now I get it.
And it's also
I
massive.
see what you're saying, I
Yes.
just, the people that aren't here, aren't here.
Too bad.
So, yeah, I agree with tabling it for now.
All right, it's tabled.
All right, so Kenan, I guess we need to remove that from the election?
Sure, I can do that. I'll do that at the end of the meeting.
Okay.
Yeah, I'll pull it from the ballot.
Okay. So the next item on the agenda is the election. We have 3 open seats, including the chair position. We did have 5 individuals accept their nominations for those open seats. I won't go over the full bios because they're available in the survey and on your ballots, but just a heads up. First up, we have Jeanette Grimes. Many of y'all know Miss Jeanette. She's been a wonderful member of our leadership team for the last year. She stepped in on a leadership team member who was stepping away in their last year, so she is running for her full consecutive term this time. She's currently a community health worker with VDH on her way to Danville, as y'all heard. But Ms. Grimes has over 3 decades of experience working with nonprofit organizations. She is a huge advocacy leader and has done a lot of work in various communities and various capacities. She particularly enjoys working with the youth and folks in our community who are highest priority. And she is grateful for each opportunity to help communities and families. She has expressed her gratitude to be a part of such a positive community and likes to leave audiences with the words, "I wish you well, I wish you wealth in every area of your life." So that's Ms. Grimes. The next person we have running is Catherine Maloney, also a familiar name. Catherine has been a very, very active member of both our All Members Coalition and the leadership team. She was one of the folks who were most vital in getting the 2020 bylaws drafted and passed. She currently serves as the fiscal agent or the CFO, excuse me, for Tri-County Community Action Agency, but has a wealth of knowledge in both nonprofit management and also background in tech and economics. Okay, so her desire to work with coalition members and the leadership team is to assist the coalition with its goals, mission, and vision for a drug-free, healthier Southside Virginia. And she is a resident of Chase City. The third person we have running is Mr. Dennis Damians. Also has been a huge active member for our coalition this year, has really, really been vital in helping us get more connected to the veterans sector and making sure that we are engaging folks there. Dennis has a lot of experience. He's been a public servant for most of his life, including time in the Air Force and also with the federal government as well. He has been working with the local VFW since 2009 and has helped start the program Vets on a Roll, which helps disabled veterans have fishing trips on Bugs Island Lake. He is retired and currently lives in Boynton. Next up, we have Kevin White. Kevin White is is a newcomer to our coalition, but is a committed public servant and a native of Mecklenburg County. He currently serves as a school resource officer with Mecklenburg County Sheriff's Office and is the owner and program director of We Care Family Support Services, where they offer after-school programs to youth. Outside of his professional endeavors, Kevin is a family man and has a beloved fur baby Jackpot. All right. And then last but not least, we have Dr. Skylar Wells. She is a dedicated educational professional currently at Chase City Elementary School. She is serving as the testing and remediation specialist and leverages her expertise in student assessment and academic support to enhance learning outcomes. Her doctoral dissertation focused specifically on adverse childhood experiences, or ACEs, a subject that she is deeply passionate about. And she continues her work to advocate for the educational needs of vulnerable children and families, making a lasting impact on both her local community and the broader field of education. So those are our 5 candidates. Like I said, all of their bios are available in the survey online. Please make sure that you go in and vote before midnight on the 27th so that we can start off strong with a new leadership team. Not completely new, but some new folks on our leadership team, I'll say. Any questions about the election?
And also in that link on the newsletter, you've got the bios of the returning leadership team members as well. And I dropped the link to the voting in the chat box earlier. If you wanted me to drop it again.
I have a question, Kenan.
Obviously, I will have to drop that 4th question out after the meeting, but just in case folks haven't seen their newsletter, haven't opened it up this morning, the SurveyMonkey link to vote is open and will open and stay open until, like you said, the 27th.
I have a question.
And you guys in the room have the option to vote in person if you want. And then I'll record those votes as well. So folks in the room have a hard copy. I'm sorry, go ahead.
If we already voted, will we need to do that again after you drop that?
No, I'll just drop the question.
Okay.
No, it won't impact your
I
vote.
already voted, I just didn't know if we can do it.
No, no.
Get her done.
That's right.
Okay. And then Kenan, will you put the agenda back up for me, please?
Absolutely, absolutely. Absolutely. There we go. Absolutely. Okay. All right, screen should be changing.
Mm-hmm.
Oh, there we go. All right. Do you see the next item?
Yeah, the CADCA forum.
Yes.
I can talk about the forum, but will you talk about the mini academy?
Absolutely.
Okay, thank you. So as some of you may be aware, coming up in February is the National CADCA Forum. This is a national summit held in National Harbor, Maryland every year. It is all of the coalitions across the nation. And so it's a really great opportunity for coalitions like ours to get together with other folks in different regions and learn about what they're doing. There's also a huge presence on a federal level, so there are a lot of DEA folks there, a lot of Homeland Security folks, just to give us a broader oversight of what they're seeing in terms of substances and the new trends of how things are coming into United States territory and what that may mean for how we're seeing those sorts of trends in our community. So it's a really good opportunity to learn a lot. We are very excited to be able to send 5 folks this year. And so currently we have Kenan, Jeanette, Veronica, Dennis, and then Alex, who was our speaker in November, scheduled to go. And so they will be in National Harbor from February 3rd through 6th. Look out for more information from them. Another great opportunity that CADCA provides is that there is a legislation day. And so all of the members of the coalition are able to go to the Capitol and meet with some decision makers and representatives from our country. Last year, we were fortunate enough to meet with a representative for Senator Mark Warren, and we also met with Representative Bob Good as well. And so a great opportunity to get the needs of the South Side in front of some folks who are very powerful, but also to, hear what other folks across the country may be experiencing and understanding how we can collectively join forces to do this work and do more good. Elena, Chris, anybody who's been to CADCA, do you guys want to add more notes or anything I missed?
I went this year. And I'm actually a little disappointed I won't get to go next year. I think it was great. I think it's going to be a really exciting opportunity for the members who are going.
It was a great conference. Definitely take time to check out the individual community projects. Those are posted on boards. I believe it was to the back of the vendor room. And great projects, great youth initiative projects. And I would love if we're hoping to grow our youth initiative. I would love it if anyone would maybe even screenshot some of the youth projects that they've done across the communities. That's one thing we wish we had focused a little bit more on. Fabulous conference.
Thank y'all. So if you're interested in going in 2026, let us know. We'll put you down. All right, Kenan, I think I'm turning it over to you for the mini academy.
Yes. And question?
Yeah, one question. I do understand that there is a youth portion.
Yes.
Should we try to use that as an opportunity to
Yes.
recruit and
Absolutely.
youth, I'll learn to speak, for attendance so that they too then have opportunities to bring some of that leadership back for our local communities?
Yes, that's an ongoing opportunity that we have discussed before. They have a whole different
Correct.
set.
Yeah.
It's like YADAP. They go with an adult, so they have to have 2 adult sponsors travel with them, and they will go to the same resort, same hotel. Thousands of kids attend that every year. We would love to do that next year. That'd be great to
Right,
make it
because
happen.
you need 2 people for 1, well, 2 people for 1, 2, 3, 4, 5, whatever
Right.
amount of kids. So if you can send
Right.
1 kid, you also have to send
2 adults.
2 adults willing
Right.
to
Right.
supervise and chaperone.
Right, and the coalition can absolutely support that.
Okay.
And when you guys go this year, those are the conversations you could have with folks that are already there, that have students with them. Like, how's that process been successful for them? What have they done? Absolutely. Can you guys hear us still? Veronica, can you hear us? Okay. All right, the next item is the CADCA Mini Academy. Just to explain, it certainly connects to the National CADCA Forum in National Harbor. That's a national CADCA opportunity for folks to learn about coalition work. CADCA is Virginia's mini academy that they have about every 2 years. I went a number of years ago. Stephen went a number of years ago. It's a great opportunity. We did receive a request from our funder that says that we need 2 people at minimum to attend this training. Because it does a deep dive into learning about coalition work, it is divided into 3 days, 3 full days, and it's expected that the 2 people who attend, or 2 or 3 people who attend, will also attend the second set of dates. So it's March 4th through the 6th, which will be in Richmond. I don't know the location yet, but that is the general location. Week 2 is April 22nd through the 24th. Again, that will be in Richmond. And I am preliminarily being held 2 seats by the state of Virginia. So we do want to send a small team, as I have on the agenda, and I just got the dates like 2 days ago. That's why they're not on the agenda right now. But it's March 4th through 6th and April 22nd through 24th. 3 full days in Richmond. We provide all the accommodations, reimbursement for meals, all the stuff we always do.
Except for travel, right, Kenan?
Well, the stipend that we give to coalition is higher than what we give agency folks.
Yeah.
So it's got a little travel in there, not much. I think it's like $18.
Okay, we can carpool.
Yes, absolutely. You can carpool. You can fly.
$18 on Little Debbie.
Don't fly to Baltimore though. No.
However you want to get there is that, as you know, your buy-in, right?
That's all right.
All right. And of course, the note says that they're going to be pulling 30 people from across Secova, the coalitions of Virginia. They would like to see if we could send a variety of preparedness, meaning that someone might be new to the coalition, might someone be an advanced member of their coalition. So it's interest and desire and passion and motivation we're looking for as to why you would go spend 6 days, again, to learn the latest and greatest information about coalition capacity and coalition building.
And also, if somebody's going and they're not currently on the leadership team, I would hope they have aspirations to be, we'd like to take advantage of whatever they've learned.
That's a great comment. If you guys heard Stephen say that if the person who attends is not currently on the leadership team, but their overall objective would to be a part of the leadership team because they're learning about all the various workings of a coalition.
Logic models, how do I identify and plan for and execute a game plan, basically. Right?
Yep. Yep, and especially as you mentioned earlier pertaining to youth development, right?
Yep.
Okay.
All right.
Anybody?
Any other questions on the mini academy? All right, hearing none. Next on our agenda is the Coalition Readiness and Effectiveness Survey. This is a survey created by a group called Omni. It is a tool that is used by all coalitions, basically to gauge how well our members are engaging with each other or engaging with the community, and also to gauge how well our coalition is serving the community based on the needs of our community. And so it's really, really important that folks across our community take this survey. It is opening in February, and then I think we will know the results in June, Kenan, because it's open February through April, right? And then Omni is going to give us the results in June.
Yes, I'm actually in the process of working with Omni on our flyer that we're going to be developing and the incentive. So going back to the active coalition membership conversation, this is a coalition readiness assessment for coalition members, not for the community at large. So we will be developing a survey link along with that incentive that then we will launch in January and run through mid-March to April. Again, that's depending upon the quick response of memberships to respond to the survey so that the Omni can receive directly that information and then get a summary back from it. We do have to have the process completed by June, but I don't believe with my now team of Power of 3 that it will take us that long to reach out to each of the active members and get them to complete the survey.
Kenan, can you please talk about a couple of the things that would warrant somebody's submission invalid? I know there are a couple things that if they submit or if they check something.
Sorry, yes. So some details about that is that this is creating a flyer that when they complete the survey, they do have to put in what county they're from and the name of the coalition. So if they leave the name of the coalition blank.
Kenan, I'm sorry to interrupt you. I can't really hear you.
Yeah, I was getting ready to say that. Something happened, you popped out.
Okay.
Now talk.
Okay.
Same.
So
I can't really, there's like an echo or sort of, I can't really hear.
Yeah, it's very hard to hear you.
Start talking now. Let's see if it was the way you were bending, maybe.
Stephen wants to know. You can't hear me, but you can hear him.
We can hear you. We can hear you now. We can hear you. Yeah. We can hear you now.
Okay. I don't know. Maybe something's glitching. It might be the internet in the building. You never know.
You're fine now.
Okay.
Just stand.
Oh, look at but the camera has me way up. All right. So it's really important. Omni suggested that we make it clear to folks about how to fill it out. So they have to have the name of their county correct and general understanding of the name of the coalition, obviously. Other types of reasons to invalidate it, that would be on Omni. That would not be my decision.
Now, are there drop-down boxes, Kenan, where it'll say Southside Wellness Coalition, or like if they put SWC in there, will they know it's us, or?
It will be a drop down that you'll fill out, and then certainly I will give Omni the names of the coalition and its acronym.
Okay.
Yeah, but that'll be up to Omni whether any type of information is invalid. That's not gonna be my responsibility. Does that make sense? I'm not quite sure what else to say about that.
Yeah, that sounds good. I just remember at the leadership meeting, you shared that if somebody got the county wrong or got the coalition name wrong, it would automatically disqualify that response.
Well, it'll put the survey in the review, right? If they put down that they're participating in the Danville, they put Danville, then it's gonna go into the RASAP stack, right? But that's some technical stuff that Omni will have to figure out. Now, they will report back on a regular basis how many surveys have been completed and reviewed and accepted, which is why, again, we'll launch it in January and run it until mid-March if necessary.
All right, sounds good. Thank you. All right, next up, we have an update from our TARP. So Chris, I'll pass it over to you.
Thank you. So we're super excited about going into 2025. Back on December 10th, thank you for Kenan's team for sending out a great email blast that is sent out an invitation for nominations for potential leadership members for our area trauma-informed care network. And we got a great response, a variety of individuals across our catchment area. I am hopeful that we'll get a few more possibly from Brunswick, but lots from Mecklenburg, lots from Halifax, super qualifications on all of those individuals. So we tentatively have 2 meetings in January planned. And these are interest and planning meetings. These meetings tell a little bit more about our trauma-informed care network, our expectations for participation on our leadership team, and some of the plans that we have coming forth for the upcoming year. So if you know someone, I'm actually going to add that to the chat, which is our link to nominate someone who might be a positive member of our leadership team. And that, if you could send that in the next day or two. We are, like I said, I am sending out some invites today for people to participate in our 2 meetings that have either been nominated or have self-nominated to participate. And these individuals will also receive an invitation to hopefully be attendees for the upcoming Creating Trauma Sensitive Schools virtual conference. So I'm hoping that those will be great participants in that as well, Kenan.
Awesome. And can you drop in the chat box or say out loud what dates you're planning to have those meetings?
Yes, those meetings will be tentatively January 7th and January 21st at 6 p.m. And those will be strictly for the individuals that were either nominated or self-nominated to participate in the TARP leadership.
Okay. All right, awesome. I got it. And an update on the conference. We did have a statewide meeting just a few days ago, waiting to get further confirmation, but we are planning to launch an outreach to folks who are interested in the TICIN to attend the Creating Trauma Sensitive Schools conference at no cost. I've asked to fund 200 seats in our area, and we're just waiting to get confirmation on that. That would be a great opportunity for folks in our area to attend and learn more about being connected to a trauma-informed care network.
Definitely. And it has, the emphasis obviously is on schools and working with youth. So I hope our local schools in the catchment area will take advantage of that for their staff.
Right. The conference itself is February, hold on, where'd my phone go? Chris, do you know the exact dates of that? Hang on. That's a great question. I should have known the answer to that.
20th and 21st, Kenan, for virtual of February.
Yep.
February 20th, Thursday and Friday, the 20th and 21st.
I don't have the times, but typically virtual conferences start about 9 o'clock and run usually till about 4.
Oh, it's 2 day full days.
It's 2 days, full days, yes.
Okay.
Christine's right, 20th to 21st. I've got creating trauma sensitive schools virtual 2 day, 20 to 21st. Also with requesting those 200 seats, just so you know, we will not be blasting that on social media to pick up people that are not involved in this type of work per se. So we'll be sending them out by invitation and then documenting that they are in agreement to help us build out our trauma-informed care network. Which that makes sense. Okay, hold on. Once I have the engagement flyer and send it to Christine, then we'll start recruiting people to attend that conference. And that's going to be a real quick turnaround, by the way. It's going to launch in January and run for about 45 days. But a great opportunity to recruit folks from all the school systems.
All right, thank you. Up next, we have an update from our continuum of care. Elena?
So we are doing our annual point in time count on January 22nd. The point in time count is an annual count that we do of, it's sort of like a snapshot of the homeless in a particular area on a particular day. We do it in January. That's typically the coldest time of the year. And what we'll be doing, so people from our agency, I work at Tri-County, will be going out to our 4 counties, that's Mecklenburg, Brunswick, Halifax, and Charlotte, to see if there are any homeless people that we can encounter who may be needing assistance, and also counting anyone that we encounter. So I'll have a little bit more information on that next month's meeting, since it'll be a little closer. But if anyone knows of anyone that is homeless, sees anybody that they think may be homeless, that's the kind of thing we want to hear about. So like I said, I'll give y'all some more information on that next month at our next meeting, because it'll be right before we do the point in time count. But I'm sorry.
Elena, question
Yes.
from Catherine. I know I'm with County,
Yeah.
but we ask members in the community to help with that effort, like by, if you know where homeless people in those areas hang out.
We ask that they contact us. We don't want to, it's sort of a liability to say, hey, if you see somebody on a bench, go talk to them. So we don't want to say something like that. But we do want to hear about it, especially if it's someone that you may have encountered a few times and you think may chronically be homeless, because there would be a very good chance that we could interact with them at that point.
Right, yeah, like I've heard that there's a place in Halifax County under a bridge where people hang out.
Right.
So,
and that's the kind of places that we'll be going to. And we have specific locations that we go to, and those are advertised. We sent our article off to the newspapers today, so that should be appearing very soon. It'll be saying where we'll be. We'll also be giving out food and hygiene items at that time to anyone we encounter, and offering shelter to anyone that we can verify is homeless.
Elena, can you just provide a little bit more information on how y'all are defining homelessness and what you will count?
I just got your text, sorry, so it threw me. So we use the HUD definition of homelessness. That means that someone is literally homeless, like sleeping outside, sleeping in their car, sleeping in a place not meant for human habitation. So if you're sleeping on a friend's couch, I personally think that that means that you're homeless, but HUD doesn't agree. So it has to be someone who has nowhere to go tonight, is essentially the rough definition.
and to answer your test. Yes, that would be great. We would love some help with that.
Okay, sounds good. Thank you. Any questions for the continuum of care or the PIT count? All right, hearing none, I'm going to pass it to Dennis for veteran outreach. If he's talking, we can't hear him online.
Veteran outreach, if you are the spouse or family of a deceased veteran, please either send me a note or I will get you in touch with our veteran service officers to make sure you have gotten the benefits you should receive as a surviving spouse. So it's very important. We're running into numbers of widows and widowers that do not realize they are due. And again, Allison, I'm sure you ran into the same thing.
Yes, definitely. And our veteran service officers, there are a couple of VSOs that have like branches in the VA hospital. So they've been really a wealth of information and guidance for a lot of those veterans and family members who are looking to apply for veterans benefits, because that goes through the VBA, the Veterans Benefits Administration. And so I work for the VHA, which is the healthcare. So they're both under that VA umbrella, but they kind of are like one's the left hand and one's the right hand. So it can be definitely a process applying and getting those benefits. And so our VSOs are really great partners in helping people do that.
We're done.
I had one more thing I wanted to mention real quick. We every year our Office of Mental Health and Suicide Prevention at the VA does an annual report, and so that annual report is about to come out. It's not quite out yet, but if you all would be interested in me kind of going over some of the high points from that data set, which would be covering usually it's 2 years back, so I believe they're going to be looking at the data from 2022 in terms of veteran outreach and veteran suicide rates. I'd be happy to present on that or just share the link with once it comes out. So just let me know.
Thank you, Allison, and thank you, Dennis. Any questions on veteran outreach? All right, hearing none. At this time, I want to turn it over to the members. If anybody has anything they'd like to share or any updates, please do.
All right, I'll go first. I'm in the room here. I handed out a flyer to everybody that was in the room. I sent Kenan via email a QR code. This is Catherine. I hope you can hear me. Tri-County Community Action Agency is actively involved in a needs assessment. Breanna talked in great length about a needs assessment. We're doing the same thing. We are mandated to do this every 3 years. So our 3 years is up and we are doing it. This is a little late, so I would appreciate your assistance in getting this out. So Tri-County offers a lot of services, from domestic violence, sexual assault, to weatherizing people's houses, Head Start programs, etc. And what we need to do is every 3 years we go in and say, are we serving the community to the best of our ability? Have communities' needs changed? And that's what we're doing right now. So there is an online survey. This is due tomorrow, so I apologize for the late information. But if you could use that QR code, it takes maybe less than 10 minutes to fill out. Just like Breanna said, we need a vast amount of people in all 4 or 5 counties. It's Lunenburg, Halifax, Mecklenburg, Charlotte, and Brunswick. So if you know anybody and can get them that QR code, we need to know how we can help those people in the community that are experiencing, you know, the effects of poverty, the systematic effects of poverty, And whether that's homelessness or they just need a little bit of help. So your help would be appreciated. If you have any questions, reach out to me. I'll be happy to assist in any way I can.
And we already took that flyer and QR code. It's running actively on the coalition social media. You said it closes tomorrow?
Yes, it closes
Okay.
tomorrow.
So it's been up there for a few days. I didn't tell Sarah to close, to Ellen to close it anytime soon, but I'll tell her.
Catherine, is that related to the focus groups they were doing a couple weeks ago, or is this a separate process?
Good question, Liam. I do not know the answer to that. I'll get back to you.
Any other news or updates that members would like to share?
Hi, me again. We are really excited. We're working on launching the Heart Health Ambassadors program for Halifax. And so we're actually in Pittsylvania-Danville and Halifax right now. And the reason it is those 3 areas is because they are identified as 3 of the areas in the state with the highest rates of blood pressure among people. The first part of that program is putting together what they call a learning collaborative. So we are looking for community members who are interested in improving heart health within their communities. We have to have at least 51% of the people living within certain census tracts, but we can identify that. And we really want the community members, not so much the stakeholders who already have their voices heard. We really want some community members who don't have that opportunity. So if anyone has people they think would like to participate, or if they would like to participate themselves, please let me know. We would contact them and do a brief one-on-one interview, just kind of asking some questions. And then we'll select 10 to 12 people, I think is what it is. It might be more than that. To serve on the learning collaborative, and part of what they would do within the learning collaborative is launch the Heart Health Ambassador program, which would be a 4-month program where individuals get a blood pressure monitoring cuff and they learn how to properly take their blood pressure, report it back to their doctor. And then each month we have one learning session that talks about something related to heart health, like different diets that could help, nutrition, getting active, things like that. So if anyone's interested, please let me know and we can connect you to my team who's working on it, set up an interview.
Great, thank you, Breanna. Any other member news or updates? Ian, would you like to share any training announcements?
Yes, they're not in this agenda, but we are announcing our first 6-month worth of virtual Revive trainings as Lunch and Learn. That flyer will be going out in our February newsletter. We have 4 adult mental health first aids that will be launching in January and February. We are going to be hosting some of those in Halifax and South Boston at SVHEC, some of them at VCU CMH, the hospital, and one here in Clarksville. So we're trying to make sure our mental health first aid trainings are available to folks in all 3 counties at easily accessible sites. That flyer will also go out in next month's newsletter, if not before, on social media, obviously. And we don't currently have any assists scheduled for early January, February, or Safe Talk or ACEs. So if you know of anyone interested in scheduling those, please let me know. But dates are in the works. And then Christine and I have already talked about the Trauma Informed Care Network participating in the chocolate milk screening sponsored by Tri-County Community Action on the evening of January 16th, I believe. We will have that information coming out very soon for those connected to the Trauma Informed Care Network. That's going to be a panel discussion of community folks and health workers around breastfeeding conversations and information for young mothers. Right?
Yes, it's designed to, we're kicking off our 60th anniversary at Tri-County Community Action Agency. And this is the first of events that are going to be happening. And this event is designed to break down the stigma attached with breastfeeding in the Black and brown and minority communities. And so they're gonna kick that off and go into some other events also that we'll be talking more about later in January. So it's a great opportunity for anyone you know who's new mothers, thinking about becoming pregnant, maybe has a child already. So our infant and maternal health program and coalition is that gearing up to put that on.
And it is the 16th from 6 to 9 at the Prizery here in South Boston.
And thank you. I just saw that on my phone. I was looking it up.
Thanks, Elena.
You're welcome.
Thank you.
All right, y'all. Well, we have reached the end of our agenda for today. As a reminder, the next coalition meeting is a hybrid meeting on January 16th. As always, you can join at the Southside Behavioral Health Administration building or via Zoom. I just want to extend a personal thank you to all of you. It has been a pleasure and a privilege to serve as chair of the Southside Wellness Coalition. I really love the mission and the work that we all do. I love engaging with you all as partners and as collaborators. And so I wish you all a safe, healthy, and happy holiday season and an abundant new year. Thank you all so much, and I hope you have a great day.
Thank you, Leah.
Thank you.
Thank you.
Meeting is so adjourned, 11:29.
All right.
Should I just get